Very good, very good. Well, so so for example, if for whatever reason the member doesn't enroll in time, they miss, that window of the 7-month period that you mentioned, what is going to happen?
And when you do enroll late, there's hefty penalties that will make it less affordable. It will make it, and then at that point, it's pretty much mandatory to take the insurance because, the Obamacare or the ACA already knows that you qualify for Medicare, so you cannot have that coverage.
Hello, another week of Entérate Medicare podcast, and today we're having our guest, Joseph Correa.
Hi, Sarah. How are you?
I'm very well, thank you. And yourself?
Pretty good.
I'm glad to hear that. So we have actually a few questions for Joseph. So let's start as an insurance agent, because you are an insurance agent, correct?
Correct.
Okay. And you do both individual under 65 and you do also Medicare?
Correct.
Very good. So how would you guide your client that it's turning 65 onto Medicare?
Yeah, see, what we've noticed is that, most people pay their Medicares, since they start working, they take it out of a paycheck or when you do your taxes. And most of those people, when they turn 65, they don't even know how to enroll or what the process is. So what we do is that for all those clients that are under 65, we started reaching out to them the year that they're about 64 and when they're going to turn 65, what the process is. That process is mostly we guide them to go to the Social Security because, they have 3 months before the birthday month, and 3 months after to enroll into what it's called the original Medicare.
Okay. So they have like
Part A and the Part B.
7-month window.
7-month window.
Okay.
And what we try to do is, because, there's a little bit of extra information. Like if you're going to retire, it's mostly automatic. But if you're going to continue working, which most clients do now because people want to retire at a later age to get more income from their pension, is that they either call the Social Security or go to an office and make an appointment to actually enroll in Part A and Part B.
Okay, very good. So let's go ahead and talk a little bit more about, how we guide them, how we, basically the steps of, how they can apply for Medicare so our audience will know.
Yeah, so as I mentioned, we pretty much tell them to go to the Social Security or call them to see if they're eligible. So for you to qualify for Part A and being free, okay, you need to at least work 10 years in the country because that's how you earn the 40 quarters or the 40 credits. The Part B, which is the one that they have to voluntarily enroll, that has a cost associated with it, which is about $174 this year.
$174.70.
Correct.
Okay. And of course, since you have them in your individual health insurance through the Obamacare marketplace.
Correct. The majority.
And I assume all those members are paying a lot less than $174.70.
That's correct.
So then what happened when you tell them that now they will have to pay that amount?
There's multiple options that we can explore. One of the options is that, once you have original Medicare, you can enroll into a Medicare Advantage, which is also known as the Part C. Some of those plans give you the extra coverage that doesn't cover the original Medicare, but you still have to pay for that Part B. Now, there's extra help that people can qualify for. And in our office, we actually have a community partner from the Department of Children and Family where they can go and apply for that help. That's pretty much called the Medicaid, or for the LIS that helps you with the medicines.
Oh, so that's great. So, for example, if you know that that person has financial issues or are under the poverty level, is that right?
Correct, yeah. So it's for people that are, their income is pretty low or they don't have, they need to meet with certain criteria that you only have certain income per month and that you only have one house, one car, that sort of thing. They help you because, they know you cannot afford, the $174 premium plus the benefit, the cost of inside of the insurance, right? Like the medicines and the co-payments and all that stuff.
Oh, okay. So that's a great help then.
Yeah, it's kind of like the Obamacare that helps subsidize the plans. The Medicaid helps you cover what original Medicare doesn't cover.
Very good. Very good. Well, so for example, if for whatever reason the member doesn't enroll in time, they miss, that window of the 7-month period that you mentioned, what it's going to happen, because I know a lot of members, they wanted to continue with the Obamacare because of the cost, and they don't care much about going into Medicare. So can you explain a little bit more for the audience to know exactly what's...
Yeah, absolutely. And that's one of the reasons why we approach our clients earlier, because we've run into instances where people have to enroll late. And when you do enroll late, there's hefty penalties that will make it less affordable. It will make it, and then at that point, it's pretty much mandatory to take the insurance because, the Obamacare or the ACA already knows that you qualify for Medicare, so you cannot have that coverage. And if you try to get a coverage on your own, individual coverage at that age, could be, thousands of dollars a month for the insurance. So the penalties are if you don't enroll for Part B, it will be 10% of Part B for every year that you don't enroll. So imagine if you already pay 174 with 70, and there's 2 years that you don't enroll, 10% of that is $17 approximately. So it will be $34 extra if you enroll 2 years late.
And that's a month.
And that's a month.
And that's forever.
And that's forever.
Wow.
And that's only Part B, because then, like I mentioned earlier, you also need, depends on what route do you take, if you go to a Medicare Advantage or if you go with a standalone PDP plan, which is a prescription drug plan, there's also penalties on that as well.
Okay. So the audience should know that they cannot continue with the Obamacare. They need, or they have to, let's put it like that, they have to enroll in Medicare and cancel the Obamacare.
Perfect. Yes, they do. And the easiest thing to do is just check. If you're eligible for Medicare, just enroll in Medicare, because it's going to be the less expensive in the long end.
And then I heard too that Obamacare will not be canceled by itself. Once they enroll in Medicare, they have to call the marketplace.
Correct. And for our clients directly, we coordinate it, right? So we tell them, hey, once you get the original Medicare, and we know the effective date for Part A and Part B, that usually and that effective date is when we cancel the Obamacare, because you can have both.
Okay, perfect. Okay, so what are the enrollment options, once they get into Medicare? What would you say?
So, like I mentioned earlier, initially for the clients that are just turning 65, they have the initial election period. That's when they qualify for Part A and Part B. At that point, we pretty much have to have a conversation with the client to see what their medical needs are in terms of doctors and medicines, to be able to determine what's the best route. Because, for example, one route is to go, like I mentioned earlier, with the Medicare Advantage, which is the Part C, that includes the prescription drugs in the plan. Okay, and some of those plans, are pretty much provided by companies, like private companies, like Florida Blue, Humana, all those companies, right? So, and then the other option is if you want to maintain the original Medicare, is that you can go to any doctors outside of any organizations, that you don't depend on an insurance organization, is to go with a supplement plan, which pretty much by the name, it says it itself, it supplements anything that the Part A and Part B does not cover. But in that case, you do have to get a separate plan for the medicines, for the prescription drugs, which is called a standalone PDP.
Great. And you are nationwide, is that right? I mean,
Correct.
you can enroll anyone in any state.
Yes. So, not all the states, but right now we have about 28 states that we have licenses, and we work with the different companies that work on those states.
Very good. And any other enrollment periods? So, for example, like when the member doesn't enroll in time and they said, oops, I forgot, my enrollment period. any other enrollment period that they might have, at least to get enrolled in one of these Medicare plans?
Yes, yes. And actually, as we know from ACA, there's a couple of enrollment periods, the open enrollment period, and then the special needs, okay? But in Medicare, we have more. So, as I mentioned earlier, once you turn 65, you have the initial enrollment period, which is 7 months. It's 3 months before your birthday, and 3 months after. Then we have the annual enrollment period, which goes from October 15th to December 7th. And that's when, people that already have existing Medicare can enroll into a different plan if they already have one, or if it's, switching to another plan for the next year. Then the following year, we have another period, which goes from January 1st to March 31st, which is pretty much what they call the open enrollment period, where somebody that already enrolled in the previous period can change from a Medicare Advantage plan to another Medicare Advantage plan, or if they had a Medicare Advantage plan and they want to go back to original Medicare. And then the one that we pretty much have in both periods is the special needs or change of circumstances, which is a special enrollment period for people that, moved away from the state or from their zip code, or they had Medicaid or gained Medicaid or lost Medicaid. So all those conditions are pretty much based on the special enrollment period.
So those are like, they call it the special needs plan, the dual eligible for Medicare, Medicaid.
Which is the one where we mentioned that we have a community partner in our office that helps you process those applications.
No, that's great. That's great for the community to know. Well, so thank you so much for that information. It's been very valuable for our audience. So I wanted to bring you back so we can talk about, a little bit more in depth of what Medicare offers. And thank you so much. Another week of Entérate Medicare podcast. This is Sara del Pino.